Today I'm talking about simple at-home tests for cataracts, including a few visual tests you can do right on your phone screen. Most people wait for their yearly eye exam to find out what's changing. But cataracts don't usually show up overnight. They creep in, your brain adapts, so you can lose quality of vision for a long time before you fully realize it's happening. And by the time you notice, it may be already affecting safety and independence. Hi, I'm Dr. Ilan Cohen, a cataract and premium lens surgeon in the New York area with 25 years of experience. And I see this pattern constantly. People think their vision is fine, but when we test them in the office, things look very different. So here's the plan. I'm going to walk you through quick at-home checks for vision, glare contrast, color shift, and brightness test. These are not a diagnosis, they're a screening tool. If a few of these are clearly off, especially in one eye, that's your signal to get a proper exam sooner rather than later. One safety note before we start. If you have a sudden drop in vision, flashes of light, a sudden shower of new floaters, a curtain or shadow in your side vision, severe pain, or major redness, don't do home testing. Get urgent care. Those symptoms can point to retina problems, bleeding, inflammation, optic nerve issues, and other serious causes of vision loss. Cataracts are usually gradual and painless. Now about the rules that will make these tests meaningful. Rule number 1, test each eye separately. Your better eye can quietly cover for your weaker eye. Rule number 2, don't press on your eye, just cover it gently with your palm. Rule number 3, be consistent with your phone. Use one brightness level during the whole testing session. Don't change brightness in the middle of the test. Rule number 4, use your normal glasses for the task. If you read with reading glasses, use them. If you wear distance glasses, use them for distance test. Okay, let's go. The first test is real life distance clarity. Pick one distant target you look at all the time. A clock across the room, a street sign at the window, the scoreboard on the TV. Look with both eyes. Ask yourself, is this as crisp as I remember, or has it gotten softer? Now, cover your left eye and look only with the right. Then switch. What I'm looking for is a clear difference between eyes or a new haze that wasn't there before. Cataracts can blur, but they often blur in a specific way. It can feel like a film or a fog, not just out of focus. If one eye is clearly worse, that's important. Cataracts often don't progress evenly. That's the foundation. Now I want you to focus on what I consider one of the most important safety symptoms of cataract. This takes us to the second test, glare and halos. Do this in a dark room. Turn your phone light on and place it a few feet away from you across the room. Look at the light with both eyes open, then cover one eye and compare. Then switch. Ask yourself, does the light look like a clean point, or does it have a halo around it? Do you see starburst like spikes coming out? Does it bloom into a foggy glow that spills over everything else? If one eye is noticeably worse, that's a classic cataract pattern. Here's why. In plain language, the lens inside the eye is like the camera lens inside the camera body. A cataract is when that lens becomes cloudy or yellow. The cloudiness scatters the light, and scattered light causes glare. Next, I want to give you a test that's simple, visual, and very revealing. Test number 3, widescreen color and brightness comparison. Pull up a clean widescreen on your phone. A blank note works well as well. A plain white web page works too. Hold it at a comfortable distance. Look with both eyes, then cover one eye and compare. Then switch. Ask yourself 2 questions. Does the white look equally white in both eyes? And does it look equally bright in both eyes? If one eye makes the white look more beige, more yellow, or dimmer, that's meaningful. Cataracts often yellow the lens over time. It's like built-in tinted filter that you don't notice until you compare the eyes. Next, I'm going to shift into reading, but I'm going to keep it simple. Test number 4, reading test. Look at this image. Hold your phone at your normal reading distance. Use your normal reading glasses if you use them. Read this with both eyes first. Then cover one eye and read again. Then switch. I'm tracking 2 things. First, which eye can comfortably read smaller lines. Second, whether one eye makes letters look faded, ghosted, or washed out, even when the size is big enough. Cataracts don't only change sharpness, they change the vision quality. Next, we are going to check your contrast sensitivity, one of the first visual functions affected by cataract. Look at this image. Hold your phone at your normal reading distance. Use your normal reading glasses if you use them. Look with both eyes first, then cover one eye and read the letters across each line as far as you can. Then switch. I'm watching for the letters stop looking solid and start fading into the background. If one eye loses the faint letters much earlier than the other eye, that's a red flag. This test is critical because contrast is real life vision. Think stairs, curves, faces in dim light, and night driving. When contrast drops, fall risk goes up. So I take this symptom seriously. Now let's bring this into the real world at night. Test number 6, night light comparison. At night, look out of the window at distant lights. Street lights, building lights, car headlights in the distance. Look with both eyes, then each eye separately. Ask, are the lights clean points or do I see ghost images? Do I see streaks? Is there a haze that makes the whole scene look dirty or foggy? And here's the question I want you to answer honestly. If I had to rely mainly on this one eye, would I feel safe driving at night? If the answer is no, that's a strong signal to schedule an exam soon. Now, what do I do with these results? If both eyes look similar and nothing stood out, that's reassuring. I still want regular eye care because cataracts are only one part of the eye health. If one eye is clearly worse on 2 or more of these tests, I don't want you waiting a year. That's the time to schedule an exam sooner. And when you go in, I want you to describe your functional symptoms. Glare, halos, night driving difficulty, needing more light, colors looking dull, contrast fading. Those symptoms matter because I don't just care about what the chart says in a bright room. I care about how you function in real life. And if cataracts are part of the picture, the goal is not just to label it. The goal is to protect your safety, your independence, and your quality of life. If you want to learn more about different types of cataract surgery, click here next.